Dr. Adam Hiley at CHI Bergen Mercy works directly with COVID patients and was one of the first in the state to get vaccinated. He received his first shot on Monday. Less than 24 hours later, he's back on the job. He wanted to share with you in his own words what Dr. Hiley said about getting the vaccine.
We're at work. We have patients that we have to see, and no, feel fine. It feels like every other day. Tiny bit of soreness in the injection site at the deltoid, but really nothing else. Everything was normal. My daughter actually got her 6-month shots in the same time I was getting mine, so we were kind of vaccine buddies for the day. And she took it like a champ too. So it was kind of just a normal everyday evening, and had dinner, got a workout in, and went to bed like normal and back at it today. It feels like maybe you bumped it, like a day before, and it's just kind of that little, just tiny bit of soreness. I mean, I will tell you, last night as I, got done showering after working out, it was a little sore raising above my head, but it was nothing that limited range of motion. It was not uncomfortable. It was like, honestly, I mean, it's right on par with what I've experienced with the flu vaccine. And honestly, with the flu vaccine in the past, I have had a couple of years where I had a headache and needed to take a little bit of Tylenol or Advil. But this was nothing like that at all. So very, very simple. No nausea, no vomiting, no diarrhea, nothing like other COVID type symptoms, no fevers, myalgias, or chills or shakes or anything. Just felt normal. This was put out to us at unprecedented speed, but it's not because it was done carelessly. It was done because there was better coordination than there ever has been in the past of bringing a vaccine to to the public. I'm not going to venture out and say like everybody should take this, because then it's forcing things on people. However, I would very much strongly recommend that you should. My fellows in our fellowship program, they're all willing to go and vaccinate themselves so they can continue taking care of patients, and they all have families as well. So I don't think there's a good reason not to, unless you have one of those contraindications. You have a history of allergies or something that's in the vaccine, or you have a history that would preclude you from other vaccinations as well. I think it's important to, like I said yesterday, if it can give us some reprieve, if it can do half of what we think it's going to do, if it can lessen the cases, if it can keep people from getting as sick as they're going to get, then I'm all for it.